Dr. Kanth, why did the AGA Clinical Practice Updates Committee request this commentary on blood-based tests for colorectal cancer screening?
These novel blood tests, these are an exciting new development. This can surely disrupt how we screen for colon cancer today because they're very convenient. A blood test can be relatively convenient. But because there is so much more to consider beyond convenience, the committee wanted to provide guidance to our clinicians as to how are we going to use these blood tests, where do they fit into our current clinical practice. Dr. Ladabaum, what evidence did the authors use to inform their commentary?
The key data are how the blood tests perform compared to stool test or colonoscopy on one-time testing, and this came from individual studies for each particular type of test. The question is, what's the detection rate for colorectal cancer, for advanced precancerous polyps, for non-advanced polyps, and also what's the false positive rate? But it's difficult to judge just from these numbers how programmatic screening over time will impact the outcomes that we really care about, which are the incidence of colorectal cancer, the mortality of colorectal cancer. So we also considered how often these various tests are recommended, and we looked at published decision analytic models that try to make long-term projections considering all these inputs. Dr. Kant, what are the commentary's take-home points?
The biggest positive impact is that this test could improve overall screening participation. We know that almost 30% of people are not getting screened. So bringing in these people who would otherwise not get screened with stool tests or colonoscopy, this could be the biggest benefit of this test. However, we must understand that substituting the current blood test for stool test or colonoscopy is predicted to worsen outcomes. This is a very important message for clinicians to understand, and this test should not really be used as a first line for colon cancer screening. Dr. Ladabaum, any other important tips for clinical practice?
Yes, it's critical that patients who decline stool testing or colonoscopy understand that if they choose a blood test and it's abnormal, they must be ready to accept a follow-up colonoscopy. For the busy clinicians who are tasked with screening their patients who may have limited time for shared decision making in the clinic, probably the fairest presentation today follows your points. And that would be to say that screening colonoscopy or a program of stool-based testing with high adherence are probably comparable, but that the first generation of blood tests probably don't yet reach the same level of effectiveness. Now, for the future, if the blood tests improve, particularly in their detection for advanced precancerous lesions, then maybe one day patients would have a straightforward choice of colonoscopy, stool program, blood-based program with similar effectiveness.